Good afternoon, everyone. Now that the Republican health care bill passed the House, I want to kind of discuss a little bit about that and the outrageous response from the left. Before I do that, though, so massive Republican majority in the House, and was it one vote that it passed by? So good luck with that one in the Senate. I want to put a preface also on this before I get started. As a lifelong Republican myself, and actually somebody who sold health insurance for 26 years, so I actually kind of know a little bit about what I'm talking about. I don't want this in any way to be construed as my sticking up for those feckless, irresponsible, spineless, gutless Republicans who for 7 years were screaming, repeal, replace, repeal, replace. And then when they got the chance to actually do it, had nothing to put on the table. Not sticking up for any of them. I think you should all be fired. And you know what? My message to you is this. Read behind the curtain. Okay? We can't fire you. So now we just got to do the best we can with what we've got. Okay? Now, on to the outrageous response to the left. It's like, oh my God, the world's going to end. Okay? Let me cover some of those subjects real quick so actually people on both sides could learn something. Like, anybody want to learn something today? Okay. I'm not just somebody who just reads stuff and then regurgitates. I actually know what I'm talking about. So here's some of the highlights of the left's ridiculous response and then the responses to it. The first one, oh my God, premiums are going to go through the ceiling. Premiums are already through the ceiling. And Obamacare is what caused it. We're paying more premiums than we ever have, but on top of that, also have the highest deductibles we've ever had. It's one thing if your premium is high because your deductibles maybe is $500 or $1,000, maybe even $1,500, and have doctor's copays and drug copays. It's a different thing when your deductible is $5,000 or $6,000 and you have no coverage until you meet that deductible, which means for most things you can't even use it. Okay? Obamacare did that, okay? Only direction we can get now on this is better because it's about as worse as it's going to get, okay? So that's the answer to the first one. The second one, oh my God, pre-existing conditions are not going to be covered. Now think about this for a second. If the Republican Party put together a plan and passed it that didn't give viable, adequate, legitimate coverage to people with pre-existing conditions, they would lose power for the next 8 to 16 years. And that ain't never going to happen. Just take a chill pill for a second. Just give it a chance to go through the motions. We're definitely not at the finished product yet. There's multiple steps that have to take place before we have a finished bill. And then if it's not there, I'll be screaming right along with you. Okay? Okay. The next one. Oh my God, he's taking me to 5 rate classes. Before Obamacare happened, there were 5 rate tiers, basically. And what I mean by that is somebody who is in, say, the 60 to 64 age group could pay as much as 5 times as much premium as somebody who's in, say, the 18 to 25 age group. And, actually, people in their 50s and 60s, they have more claims than people in their 20s and 30s, they should be paying more premium. Obamacare came in and saved the day. We saved the day by having 3 tiers. What they did, though, is they took a big chunk of what they would have been charging, like the 60 to 64-year-olds, and whacked the 18 to 25-year-olds with it. Okay? That is why the vast majority of these 18 and 25-year-olds are saying, you know what? Okay, we're not paying for it. We'll just pay the fine. And you know what? Any of us who are in the industry, who understood the health insurance business, understood buying habits, knew that that was going to happen. And that single thing right there is probably the biggest reason why Obamacare is imploding as we speak and is eventually going to fail. Because what it's created is adverse selection, which means instead of getting all these younger people like they were wanting, they got a lot more older, sicker insureds. Now, those people, God bless them, they finally had something. There should have been something available to them in the first place, but the Republicans failed miserably on that when Bush was in office. That's given, okay? So you can't blame them, But the way the Democrats put the plan together, the younger people who were going to subsidize them said, not going to do it. So that's why it's imploding. That's why it's going to fail. That's what adverse selection is. Too many claims going out, not enough clean business coming in. Okay, so and as far as going back to the 1 to 5, it's just going back to what it was anyway. It wasn't the worst thing in the world, and the earth will continue to turn. The other one, oh my God, lifetime caps! You're going to take lifetime caps away. Speaking mainly for the Kansas City area before Obamacare plans came out, pretty much every plan in this area had at least a $5 million lifetime cap. Now, most of these plans, as you know, are PPOs or HMOs. So you go into a medical provider and there's a $1,000 bill, and then it goes through the process and you get reduced down to like a $600 bill, and that $400 gets cut out. Okay? So what happens is if a policy has a $5 million lifetime cap, that really means that it's addressed like, $8 or maybe even $9 million in medical bills. Now, how many people have you ever met in your life who had even a fraction of $8 to $9 million in medical bills? So the lifetime cap thing was more fluff than it was anything else. There was a company here at one point, I think it was Time Insurance Company, that they had policies with $3 million, and they created the ability to, as an option, to go to $5 million or $8 million, and it cost almost nothing to add that extra several $1 million of coverage to your policy because they never paid a bill that was $3 or $5 million in the first place. Okay, so again, mostly fluff, no big deal. Okay, now you're talking about $1 million policy. Okay, I understand. But, 5 million, 7 million, that's so much coverage. I mean, come on. Risk pools. Oh my God, they're going to send all the unhealthy people into risk pools. There's some legitimacy to that one. And the reason why I say that is this. Most of the risk pools that were around before Obamacare came out kind of sucked. The Kansas risk pool, for example, the premiums weren't bad, but the plan kind of sucked. It had like a $100,000 annual max. I think it was a $2 million lifetime. I can't remember what exactly that one was, but the annual cap on it kind of sucked. The Missouri plan was much better coverage, looked like a regular Missouri Blue Cross policy. The only difference was a little bit of a different premium because it had mostly all unhealthy people. But even though the premiums were higher for that plan, they weren't as high as what healthy people are paying for light coverage now. So again, if they're going to do the risk pool option, there better be viable, legitimate options there. Because if not, it's just not going to work. The country's just not going to accept it, and Republicans are going to go in the toilet again on that one. So that's the risk pool deal. Another one. There is, I have different, there's two different takes on this. One of the things that they're freaking out about is that people with pre-existing conditions can get charged more premium than people who don't have pre-existing conditions. In other words, going back to the way it was before, okay? And I've got basically my own opinion on that. To make this very clear, I am not talking about people who were born with conditions, congenital conditions that obviously they couldn't help. I am not talking about people who came down with conditions like heart disease or cancer or diabetes who, led basically healthy lives. These conditions happened just because they did. They didn't, these people didn't work to get to these conditions. They just kind of happened. I'm not talking about these people. What I'm going to say is directly related to the people who are going out of their way to keep themselves unhealthy, make themselves unhealthy, and keep themselves unhealthy. Perfect example, smokers. Smoking is the single worst thing you can do. The cats. The worst you can do for your health. It leads to all different types of conditions. If you're a smoker, you damn well better get charged more money because you are optionally making yourself more susceptible to getting sick and therefore having claims. Why should I have to pay extra premium for you when you're making the choice to destroy your health? Now, let's take it a few steps further. And I saw this in the health insurance business all the time. Let's say you're a smoker who's overweight. Your odds of having massive claims just went up. What if you're a smoker who's overweight, who has high blood pressure? Okay, how about if you're a smoker who's overweight, with high blood pressure and high cholesterol, and takes medication for a condition like asthma? You know what? There are millions of people like that in this country. As my father used to say, they're ticking time bombs who are subconsciously trying to kill themselves. I ask you again, guy like me, I'm 54 years old. I go to the gym 2 to 4 days a week. I play ball 2-3 nights a week. Okay. I watch what I eat. I don't drink much. I don't smoke. Why should I be forced to pay more premium because of your lifestyle habits? Now, I am not judging you. We live in America. You have the right to blow your bodies up any way you see fit. But I should not be liable to cover conditions that are coming from your lifestyle choices. And God willing, people who willingly ruin their health should pay more and will pay more under the Republican plan, because it's your fault. It's not mine. I used to see it in group insurance where you have, a whole bunch of healthy people. Then there was a few like what I'm talking about, and they couldn't care less that everybody was paying extra money because of their habits. You know what? It shouldn't happen. You want to talk about being free in America and it's our choice? Good. If it's your choice to do it, it's your choice to pay for it. Do what you want. Still love you. I'm not paying your bills. Okay? Now, the last one actually goes back to the Republicans. It's these armchair, conservative, constitutional armchair experts, okay, who have the audacity to use the phrase, you know what, you don't have a right to health care. You know what, shut up, okay? Here, see behind that curtain to you too. What the hell's the matter with you? We live in the United States of America. The United States of America has a thing called the Declaration of Independence. And in the Declaration of Independence, it has the words life, liberty, and pursuit of happiness. And two of those three are kind of hard to get if you're having heart palpitations and you're afraid to go to the doctor because you don't have access to adequate coverage or health care and you're facing bankruptcy. We're the richest country in the world. It may not be a constitutional right to have health care, but it's a human right. Come on. Stop saying it. Stop embarrassing the rest of us. We're all in this together. Aren't we? Isn't that what the conservative message is? We're all in this together. Aren't we a team? Then stop making asses of yourselves and bringing us down with you. Everybody should have viable, legitimate options. Okay, so that's all I've got for now. Anything comes up, more than happy to do another video. Have any comments, complaints, criticisms, you want to tell me what to do with myself because I, offended some of you, bring them on. I could care less. I'll probably respond to every single one of them. Have a good day. Hopefully we'll talk again soon.